Well, Dr. Phillips, I've never seen a case of Bartonella infection. I mean, I don't know how you came up with that diagnosis, but I guess your mind has sort of been trained from your own past experience. You had a chronic illness of your own that was difficult to diagnose and treat.
That's correct, yes. It was 11 years ago. I was sleeping in my bed at home. I got bit by spiders, and I thought nothing of it. And 2 months later, my entire body exploded with arthritis. And within 6 months of those bites, I couldn't take a single step on my own. I developed fevers, 102 every night. I became severely anemic. I went to 25 doctors that couldn't help me. And I became disabled from my job. But more than that, I became disabled from every aspect of my life. I couldn't turn over in bed on my own. I couldn't sit up on my own. I couldn't lift my arms against gravity. I had 24-hour home care. Everybody thought I would die, myself included. And I just want to tell people that are watching this that I have a full life now. And if people, if I can get better from that very, very low place, then there's hope for people with chronic and autoimmune illness. And I'm so glad that we're having this discussion today, because the information that we're talking about can literally mean the difference between total disability and good health.
Dr. Phillips, in your experience for yourself, but also for all of these patients, what have you found is best for treating chronic illnesses?
Well, I found that a mixture of antibiotics and some herbals and prescription medicines that are not actually antibiotics but work against these infections can all help the underlying conditions. What people don't know is that there's a tremendous amount of data that many chronic conditions that are thought of as non-infectious, like fibromyalgia and chronic fatigue syndrome and rheumatoid arthritis and even things like multiple sclerosis, there is immense data that infections can cause these syndromes. And when I first learned about this, the chills went down my spine. I couldn't believe how much data there was. And the key is to find and treat these infections rather than chasing the symptoms and suppressing them for the life of the patient.
Dana, this is something now you've dedicated your life to it.
Yes, I mean, I could not sit idly by and watch this happen to so many millions of people, never getting to the root cause. I mean, honestly, I think it's a crime against humanity to have so many people on these long-term drugs that they may not need when they have an underlying infection that can be cured.
So back to you, Dr. Phillips. We're seeing more and more people who had COVID that now have chronic symptoms, so-called long hauler COVID patients. Is this different than what we're talking about here with the chronic diseases you study and you treat?
The overlaps are just striking. COVID can actually reactivate latent infections. So many of us walk around with infections that don't make us sick, and they can become active with COVID.
What do you recommend to patients who are struggling with chronic illness?
I could tell you from my point of view, don't assume that doctors are correct when their answers don't feel right. I went to 12 and they were all wrong. Don't assume that a certain amount of antibiotics means that you're cured, because these infections can be persistent and are in a very high percentage of people, depending on what data you look at. I would say bring an advocate with you. Bring somebody to ask questions to your doctor's appointments and to take notes, because a lot of times you are way too sick and too tired and in too much despair to really get all the information that you need. And really ask, why am I so sick? Ask for the root cause. Ask to be checked for an infectious disease panel. I did those things and I was turned away, but I wish I could go back and do it over again. And most importantly, I got better. So don't lose hope.
Well, Dana, we're so happy to hear that you're doing so well and that you're taking on this cause to help others. And Dr. Phillips, thank you for your expertise and insight. Chronic illness, a difficult problem.
Thank you.
Thank you so much for having us.